What's going on, everybody? Excited to be back with you here on this Thursday, ADOM Facebook page. And we are going to continue this featured company spotlight where we spend time with so many of the great companies out there, primarily offering services that you as the dental manager can use, can learn about, and all that good stuff. So I have today with me, very, very excited to have Matt Love, who's the Director of Strategic Partnerships from Rectangle Health. How you doing, Matt?
I'm doing great, John. Thank you. It's awesome to be with you and ADOM today.
All right. Well, thanks for coming on. And we have some things we want to go over today. You guys have a lot of exciting things that you're doing in the world of payment processing and all kinds of stuff that you're going to talk about. Before we do, I'd love to have you share, a little bit about yourself, and even Rectangle Health, as a company out there and what you guys have been doing.
Absolutely, John. So my name is Matt. Working with strategic partnerships means that I have the pleasure of working with partners and their members about how to learn how to take payments safer, simpler, and smarter. I really enjoyed doing that with this Rectangle Health company and solution for a number of years. And it's important to know that Rectangle Health really isn't just a processor, as I heard you use that. Really, we think of ourselves as a healthcare payment technology company because we don't focus on just a card reader, really. Think of it as a software suite of services, runs from the cloud, and it makes everything very simple and efficient for the practice. And that's really where we focus our efforts.
Yeah, and I'm glad you mentioned that because I know you're going to get into more detail today on where people traditionally would have thought, okay, the payment processing company that I'm using just does a couple of these things. But as you're going to share with everybody, yes, you guys are you're a lot more than that. There's a lot of great things you can do, especially with some of the newer technology advancements and like you mentioned, helping the practice speed things up. Get those funds quicker from the patients, all that good stuff. So.
Yeah, that's right. We know that dental office managers are incredibly busy people and, ADOM has among the best, right? So when they think about how they're running their practices today and all the things that are going on, there's a lot of different systems. And then specifically with patient payments, they find that they're using many different systems there too. So thinking about things like registering patient visits, thinking about saving cards on file or taking payments in the office or payments afterwards. It means a lot of different systems. And ultimately that means different software. And eventually that means inefficiency. So really focus on keeping that simple. And COVID-19 has really only exacerbated things because staff now want to spend more time, keeping the facilities clean. They're thinking about what they're touching. They want to reduce the wait in the waiting room. And patients are really dental consumers, right? And so they're going to expect of practices the same types of technologies and touchless experiences they're seeing out in their consumer lives. And so our solution, Practice Management Bridge, uniquely is positioned to help provide that contactless experience. So it's simplified, it's safer, and it works with the software that the practice is already using to manage today.
Mm-hmm. All right. So I want to jump in, and for those practices out there that may not be using, healthcare payment, technology, could you set the stage in regards, especially now more than ever, why it may be, very, very important to learn more about this and incorporate it into their practice?
Yes, absolutely. So there's a lot of different payment solutions that are out there today. And if you think about the traditional patient engagement, John, it begins with a device or a card reader. And right there, it becomes something physical, right? Even if you're tapping the phone and doing something like an Apple Pay or a touchless payment, we need to really revolutionize how we think about that patient engagement. We're very much focused today on taking payment at the point of care in our dental practices, and then beyond using things like online payments. And what Rectangle Health really challenges our audience to do here is consider that pre-care engagement. How can we now set up a white glove experience for patients? So ultimately, you can have that patient registered. You can save a card on file before the visit, and then reduce the wait in the waiting room as a consequence. And that can mean checking in and checking out, and perhaps charging a card on file or engaging that patient with text. So we think about practices and this great investment they make in technology to treat patients, and the overhead of running these impressive facilities, the staff and the continuing education, it's tremendous. It makes sense that a modern dental practice would really match that technology with the kinds of payment and patient engagement solutions that we're talking about with Practice Management Bridge.
Yeah, it's interesting when I think about technology nowadays when it comes to a lot of this, like you go somewhere and it always amazes me, Matt, how like I put my card in and literally within like seconds, like everything is done, everything is easy,
Yes.
move on to the next. And I think like you mentioned, especially in this environment that we're in where a lot of the practices are doing what they can, you talked about contactless payments, making an easy way, for patients to pay. And more importantly, like you said, on the practices side, speeding up that time to make sure that the practice is getting that revenue in.
Yeah, that's right. And so you made a good example. You said how fast and exciting it is to pay with your phone, and it is. It's a great leap from having to swipe a card. But we begin to think even differently about how can we give that time back to that office manager or to that user of the computer systems to really focus more on the patient care and that patient experience, and again, the cleaning of the facility and the like. So what we do with our solutions is we provide a single interface. So when I think about one particular feature that should really resonate, it's a single cloud-based interface from which you can take a card when it's present. You could take a payment over the phone, perhaps. You could save a card on file for future visits. You could set up recurring payment plans for things like orthodontics. You could even get paid online. And really, it becomes a payment clearinghouse, John, where all payment data comes to a single place, not multiple systems. And I have that data in my practice to now update my patient ledger. So whatever that practice management software may be that I'm using, getting paid doesn't mean I don't have the data.
Mm-hmm.
How we take that payment, we can now get that information back into our system. So that single interface ultimately is a time saver and collapses multiple systems into a single system. The other thing I think about is 24/7 payments acceptance. We want to free folks in the office from having to do all these things like make phone calls, send those expensive paper statements. And so our online feature we call Balance Collect, it comes with Practice Management Bridge, and it enables 24/7 payments acceptance. That means you're no longer confined to those 9 to 5 hours, but instead patients are empowered to pay you on whatever their device may be it a phone, be it a tablet. They're in bed before they go into sleep paying some bills. It should be that easy to pay you as well. And then when we talk about that pre-care, how do we now set up the best patient experience that's touchless? And I mean not just tapping my phone, but I mean tapping nothing at all, right? Having it saved on file. Our tools really become patient engagement tools because it means your practices can send a link. A patient on his tablet, his phone, his computer is able to do a quick digital registration, giving you information at the practice, saving a card on file. And that's really empowering. And that means now that the dental office manager can have a financial conversation and set some expectations, John, before the patient's even there.
Right.
That, I think, is truly a contactless experience. And that comes with our solution, Practice Management Bridge.
So one of the things I was curious about, would love to have you share, is when you guys have customers that switch, from another platform or another company or whatever the case may be, what are some of the reasons why you see them move over?
Yeah, we see them move over because the payment solutions they're using really just take too much time or aren't getting the right result. And oftentimes, the payment processors behind those solutions, right? What they do, they do well. But unfortunately, they're also supporting other types of businesses, thinking about retailers, thinking about non-health and non-dental type fields. And ultimately that support those folks on the other end of the phone ultimately become generalists. When I think about Rectangle Health, we work exclusively in healthcare and dental payments. We've been doing that for 25 years, have a track record including tens of thousands of healthcare and dental customers using the solution. I think that speaks for itself.
Yeah.
Because from the people who talk about it and demonstrate it, John, to the folks who support it and answer questions, any technical upgrades and the like, it all comes from a group of people who understand and speak healthcare and dental care. So that's one. It's a much better type experience that's really tailored to the dental environment. The other is they're using too many systems. Again, we've talked about that theme before. They're looking for a single system instead of multiple to do the things we're talking about, like save the card on file, set up the payment plan, get paid online. It should be one and done, not multiple systems. Mm-hmm. And lastly, there are practices that are using integrated solutions today. They're using that practice management software. There's a payment integration available, but there's gaps in it, right? Those could be security gaps. Those could be feature gaps, ultimately, where they're getting paid and they have the data in the patient ledger. However, they're still having to go to another screen. They're having to go to another gateway, another website for other services. So all we do is healthcare and dental care. Our solution is cloud-based. And John, we're informed by what our practices, what our customers need. So when they tell us they need particular features, we can make an upgrade to our solution. Everyone downstream benefits. And that single solution focuses purely on the dental payments, right? And so we'll talk on a little bit about that card on file technology, the texting capabilities. That's our forte. That's where we'll focus, and yet empower you to continue to work with your practice management software.
Yeah, I love that. So let's do that. Let's get into some of the details, I guess. What would be some of the main features, some of the cool things that you guys offer that you just mentioned?
Yeah, absolutely. So the one in particular we're talking about that enables a paperless registration experience. You think about the patient who comes in and there's that traditional clipboard and there's completing that process, which it not only means touching a lot of different things, it's more time. It's that kind of ho-hum experience that the 21st century dental patient doesn't want to have. So that particular feature of Practice Management Bridge, Patient Express, provides a dashboard to the office. So that dental office manager can send registration invites. Again, inside a payment solution called Practice Management Bridge, can see in a dashboard, do we have registered patients today? Do we have their information? And it allows custom text technology. So that's not just payments related, John. So imagine the practice. So I'm speaking to the dental office managers of ADOM. Imagine the ability to text with your patients, informing them, if they're outside in the car, if you're doing concierge type care, you want to let them know that the doctor's ready to see them. If you want to simply thank them for the visit today, all of that can be done right with a non-payment related text that comes by way of our Patient Express component of Practice Management Bridge. But what's more, it can be payment related. So as we imagine the journey of coming in, having that digital clipboard experience, I've already provided that information on my tablet. I've checked in with you. I've made my co-payment perhaps with that card that I designated on file, never had to tap, never had to get a card out of my wallet. When I leave, perhaps there's a payment due later, right? There's an insurance adjudication, there's an amount that I still owe. We don't have to now spend a lot of money on those expensive paper statements. Dental office management staff doesn't have to call and spend and chase patients to get paid. Instead, it's as simple as texting. What our texting technology does is allow the sending of a note to a patient to let him know that he has a balance due, and he or she can click a link and securely pay that amount, again, on any device. As we think about that increasing mobility of patients, they want to pay anytime, anywhere. This is exactly a solution that does just that. So whether it be in the practice with a card, with the tapping of the phone, whether it be saving the card on file before the visit, setting up payment plans online, it's even texting. And again, not cobbling together multiple solutions, but instead one that, again, still works alongside the practice management software. So you don't want to forego having the patient payment information. You want to have that too. You
right.
Those worlds with the solution.
Yeah, it's interesting, having spent years working with practices and in many cases looking at their AR, what you find, as you know, Matt, there's all these little situations where you talk about a particular patient and maybe there was a $300 owed or whatever the case may be. I think what's so exciting about a lot of these newer technologies is just like you mentioned, it's them being able to pay quicker, them being able to pay mobile, all those little things, as you guys know, and I'm sure you see on a daily basis with all your customers, that all adds up. And it really, really, really helps the practice when they're trying to streamline their AR, get those funds in quicker. And more importantly, I think come to where the patients are, right? I mean, we all are now living in this world where, COVID-19 aside, like the practices want to make things even better and safer for the practice, but just a patient being able to, like you mentioned, connect when they're doing things in the evening or what have you, and not having to lose that statement or whatever. It's just, it's really neat how this stuff all ties together.
That's right. It's got to be safer, and it's giving those dental consumers, those patients, the options they want. When we talk about smarter, we're talking about making it easy, reducing the redundancy of the different systems, and again, yes, streamline it. Don't change the workflow necessarily with the patient, but make it much simpler and almost make getting paid an automatic thing. The options, right? That's flexible based on the patient before me. and can really help recoup lagging revenue by helping engage and control the tenor of that. And that's one thing that I find, John, is traditional means of getting paid are not only more expensive and require more people time, right, which equates to money. It's just also unrealistic. Patients now expect to get a statement in the mail, and they know they have time. They might set it down. They might wait. They get a phone call. They get the voicemail, right? Texting is something immediate, right? And when it can come from a trusted source and come from the practice, it is that much faster. So it's entirely a smarter way of doing it, and yet it's simpler. So we're not talking about a bunch of machines and devices and 3 different places to log in, but rather a single one. And so I think that's going to help practices, realize new revenues. I think it's going to help them focus on engagement of patients, which is increasingly important in a COVID-19 world.
Yeah, and I know we're going to touch a little bit on ROI. Before we do that, I always love to have our guests share stories, right? Success stories of
yes,
somebody converting over, utilizing the technology, and then in many cases reaching out to you guys, say, "Oh my gosh, like I never thought it would be this easy," or "Can you believe that we did this and this happened?"
Yes.
So, we'd love to have you share kind of what you guys are seeing right now with a lot of the customers that are integrating all of this and keeping it simple and utilizing the
absolutely. Yeah, I can provide one that's nearly in my backyard. There's a family dental practice, really busy place. And so as I think about the checkout experience that I experienced myself, they had 6 different windows, right? So I'm standing there, and that's where I'd expect to be called forward at this particular practice. And they're, checking insurance, and they're checking for my next appointment. They're getting my co-payment. And what used to happen there, John, is they take my card from me. And we're talking months ago. It's all pre-COVID, earlier this year. They would take my card from me. They would actually walk away with it, which made me feel a little bit uncomfortable. But ultimately, they got paid. They had something that seemed to kind of work for them at the time. But what I found as a patient, what I expressed to them was, my card sort of walking away from me. The amount of time that it was taking really meant that we were focusing on payment. We weren't really talking about how was my visit today. We weren't really talking about the scheduling piece, about the next appointments for me and my family. So it's great that with the advent of COVID-19, I was really able to have their attention. And what this practice did instead was they optimized the whole patient payment experience, and they enabled things like saving cards on file. So I was able to come in, and with a card on file, I never had to give the card. They never had to take it, in fact. They were just able to confirm if that was still my intention to pay, and I said yes. Now that liberated us to completely talk about something different. I was able to keep the 6 feet that I felt comfortable with. I didn't need to touch anything. They didn't need to touch anything. And more importantly, they had a piece of software that they'd been told couldn't be integrated to, that it couldn't have payment integration. It would have to be sort of a manual process. And we proved them wrong, because our unique technologies are configured to work with any dental practice management software. And we did the same for them. So utilizing those touchless technologies really changed patient engagement for them, gave them a simpler single system, and for them, it meant that they could still have the information. So there was no rekeying of information into their patient management system, which that was table stakes, had to have that in order to play. So
yeah, absolutely. Yeah.
For them.
Yeah. It's interesting, Matt. It's, as hearing you talk about your experience as the patient,
mm-hmm.
So long dental practices, like if we look at the clinical side, we look at them making an investment on, some of the newer technologies, to make things, easier for the patient, easier for the practice, show them what's going on in their mouth. And for the longest time, that was just something that the practice felt like clinically, like it was benefiting them. As as dentistry has become more competitive, patients are now coming in and wanting to know if the practice has invested in a lot of these newer technologies. So whereas before, certainly, from a practice perspective, it has to make sense for them, but the pressure has gone up even more, like you mentioned, because patients want that. And so a practice is always putting themselves ahead, as when they make the investment to simplify things and ultimately benefit the patient. It helps them, and it's the world we live in now. It's definitely a must when it comes to this stuff.
That's right, John. There's a tremendous value that comes with our solution practice management bridge, and it would help if I tell you a little bit more about we do.
Absolutely.
I think of us really as a consultancy as well, right? Patient payment and engagement consultancy. Because ultimately, when a dental practice is doing what's traditionally felt like it's worked, or if it's a little bit broken, right, they're looking for expertise. We endeavor to provide that. And what that means is understanding how you take patient payments today, when you need to be taking them instead, and understanding the number of different systems that you may be using and what your data needs are. And that allows us to configure something that's really unique and meets the needs of your practice, right? So it's not a cookie cutter approach that can't work for you. So we're configuring this uniquely to work for the practice, and we're advising what others in their situation have done. And so it's not just give me the new whiz-bang technology to get paid. It's really addressing the psychology of when and how can I engage the patient for payment? When to have a financial conversation and help them save the card on file. How do I understand their preferences? What are some of those seed questions that we could ask? That's what we endeavor to do at Rectangle Health, is configure the unique solution, but really listen and consult around what's going to work best for them through a solution, but also, again, with a psychology of how we're engaging the patient and training all the members of that practice on how to use those payment tools. So from someone who's very computer savvy, maybe to someone who's less so, it's very, very intuitive, very clean interface, simple to use.
So you mentioned something earlier in our conversation about the focus that you have primarily in healthcare and dentistry. And then also, I don't know if you necessarily said the word nimble, but I'll put it out there, right? I mean, I think that what's so exciting about, I think your situation and your company is that, like you mentioned, being able to listen to the practice and make adjustments, based on kind of what the needs are. And it's just, I can't stress that enough. It's been so exciting to watch as we've evolved with a lot of these technologies, the gap between communication between the company and the practice, not even just in the sense of customer service, but like you mentioned, true consultative, feedback on what's working, what's not. And I think in a lot of cases, practices benefit from all of the customers that you guys work with, because you can implement that back in, especially when you're focusing primarily on dentistry and healthcare. We see that a lot. A lot of these technology companies that have made it that, their goal to focus primarily with specific industries really make traction in the patient experience, which is really cool.
Yeah, that's right. We've really focused on dental and healthcare. And so, your typical practice is thinking about their experiences, thinking about their patient engagement. But when you look through the lens of Rectangle Health, it really scales to a much larger group of not only experts, but shared experiences and challenges across tens of thousands of different dental and healthcare practices. So I think that's a great point. I think nimble is the right word, because how we deliver the solution, right? It's internet-based. So, John, Practice Management Bridge can be used on a tablet. It could be used, honestly, it could be used on your cell phone, but it could be used on that PC, that workstation, that laptop, wherever. It's very nimble. We're able to deliver it cloud-based, and that means we can make those enhancements to the solution. There are a number of other vendors out there, right, who will say, they're working with dental and they're working with healthcare. And while that's true, they oftentimes are behind and standing behind a practice management software, right? And so there's the coordination of development of a lot of other pieces that ultimately means the technology lags, and it takes a lot of time to deliver it to the end user, right? So ADOM office managers, instead, in having Practice Management Bridge, can get the most up-to-date technology, because all we do is concern ourselves with the payment. And because we've configured it to work with your software, we really don't have to work in concert with that company. We don't have to worry about the releases for that. We can focus on our cloud-based solution, delivering the most up-to-date technology to you and training you on it and supporting you on it right now. And I think that gives us a competitive advantage.
Yeah. Can you talk a little bit about, Matt, the actual process of switching, right? So as you know, there's a lot of practices that are using some form or fashion of a lot of the services you guys offer. And, so often people see the benefits of a particular technology or adding something new, but then they kind of hold themselves back because it's like, we got to switch everything over and all the like, right? And sometimes that prevents people from taking that step forward to do something that really, really could benefit them once they get over that hump. Can you touch on that just a little bit, from here's what I currently have and that kind of transition process?
Absolutely. Doing nothing is easy. But doing something in this case is also easy. Just like ADOM, we really care about education. And we talked about those consultants earlier. a couple questions to begin a conversation, but really it's about us demonstrating and showing the solution and how it benefits you. So we empower our teammates to show, we're talking 15, 20 minutes, perhaps longer if someone would like, but we want to show that dental office manager what the solution looks like, how it works alongside the software. And we can run a couple different scenarios to show how patients are engaged in a different way, they're paying you faster, and it's all a tremendous value. So if we can step in an education role to support your members, that's exactly what we want to do. And I would challenge any of your listeners to set aside 10, 15, 20 minutes to give us that opportunity. And hearing us out, answering a couple questions is going to let us show a different world. And that's something that we can begin to employ in very short order for them. And what that'll mean is a preparedness, really a coming back, right, after the advent of COVID-19 in a smarter, simpler, and safer way with Practice Management Bridge.
Yeah, so I was asking, we were talking a little bit about some specific customer situations which you were sharing, and I don't know if you were able to get into any more detail, about return on investment, right? I know that's something that was really important that we wanted to discuss. So
That's right.
Anything in particular around that for the practice where you can really get into
Yes.
the true ROI of incorporating this into the practice?
Absolutely. So there are some hard, physical costs that practice was experiencing. So they had 3 different payment vendors, right? So that meant 3 different merchant accounts, 3 different processes, 3 different pieces of equipment. And by eliminating those, they were able to save thousands of dollars, because that also meant they were paying 3 different pricing structures. It's very confusing. And so by eliminating those other systems, they were recouping thousands of dollars annually. I think there's also those intangibles for sure, right? So their average transaction time had gone from about 5 to 6 minutes end to end of confirming the next appointment, getting the transaction, getting the information updated into their practice management software, and able to collapse that down to 2 or 3. So they had transactions happening much more simply in half the time. And for them, they were still using the same amount of time in the patient engagement, but now shifting it towards something else they wanted. The other things that we recognized from them is that they were saving thousands of dollars in their patient statement costs. So, invoicing and informing patients that there were some balances due, or, paper reminders of payments taken over the phone, or recurring payment plan acceptance or declinations. There's just a very paper intensive culture that was very costly. That was a lot of money for them as well. So I think it's the combination of the hard costs that were eliminated paired with the intangible that meant they could now grow their practice, they could now focus on the patient experience, and they could have more accurate input of information into their systems, in addition to the thousands of dollars that they were saving annually from too many systems, from too much paper.
Yeah, I love it. All right, everybody. So the ADOM team has put in a whole host of links and resource information. Matt had mentioned a little bit about consultants and all of that. So if you, right below us in the comment thread, a lot of great links in regards to how you can learn more about Rectangle Health, get in touch with one of their consultants, and spend the time to, I think, take advantage of a lot of these great things Matt was talking about. As we wrap, Matt, any last thoughts as how people can get in touch with you, the company, any of that good stuff?
Yeah, absolutely. I think in addition to the links that you've mentioned, John, you can do 2 other things. You can call 888-852-6055 to talk to one of those consultants today. You can also visit rectanglehealth.com and really preview the solution and understand how it's going to help you. Again, really encourage the educational aspect here working with ADOM. Love to hear from dental office managers participating today. Encourage you to call that number to visit, learn a little bit, but spend a couple more minutes with us to see how the solution is going to impact you. And John, we're really grateful for the opportunity. Thank you.
Yeah, absolutely. So you and I didn't have time before we went live here to kind of work on a jingle for that phone number, right? Like a lot of companies have. So can you share it one more time so that it's out there?
Do I need to sing it?
Whatever you want to do.
888-852-6055.
There you go. Love it. Got to have the phone number jingle, right?
That's right.
Awesome. Well, Matt, thanks so much. This has been great. Again, such an important service in the practice. It touches so many sides of it, makes it easy for the patient, easy, for the dental managers. And I know the ADOM team really appreciate you guys coming on today and sharing more about Rectangle Health. So we'll talk to you soon. Thanks, Matt.
Yes, sir. Thank you, John.
Got it.